Well, hi everyone. It's Nancy, the nurse practitioner, and today we're going to talk about urinary tract infections. Thank you for coming and visiting me on my YouTube channel, Caregiver Success. All right, for any of you who have had urinary tract infections before, raise your hand. I have, and it ain't fun. So we're going to talk about the number of ways we can find out if we have a urinary tract infection, how it occurs, what are the symptoms, the risk factors for a urinary tract infection, how to diagnose it, how to treat it, and how to prevent it. So get yourself a cup of coffee or some nice beverage, and let's dig in. First, let's talk about the statistics about urinary tract infections. It's one of the most common infections out there, where 10.5 million office visits are involved with this, 3 million emergency room visits, and it costs over $3.5 billion a year to treat urinary tract infections in the healthcare system. That's a lot of money to spend on something that can be prevented for many people. So we're going to first talk about the behaviors that we see in our parents, and it's a very important thing to know because we would never have thought of this as our parents are aging and start to have some problems. One of the first things you want to think about is, does mom or dad have a urinary tract infection? So I'm going to show you some of the behaviors that can happen. So here you go. Urinary tract infections, or UTIs, can cause sudden confusion or delirium. So that means the person becomes confused all of a sudden, out of nowhere. They wake up in the morning, they don't know where they are, they don't know your name. Something is wrong. And it doesn't mean they had a stroke necessarily. It could mean that they just have a urinary tract infection. They may be agitated, taking off their clothes, just being irritable and just not right. Withdrawal, sometimes sleeping a lot, just not talking, very quiet when they're usually talkative. Or a low-grade temp of like 99.5 or 100.3 orally, just out of nowhere. Maybe not eating, just staying asleep for the whole day, or just saying that they feel weak. So when you have a parent and you're thinking what's wrong, before you think of it being zebras in the woods, think of squirrels in the woods. It's going to be something more common, and it's usually urinary tract infection. And when our parents have incontinence and they wear undergarments that need to be changed, may kind of consider that. So we're going to go over things you can do that may be the reason that they may be getting urinary tract infections. So now we're going to take a minute and talk about the anatomy of the body, and we're going to go back to another screen. Okay, so this is the female anatomy here. And I know this is a cross section, so what you want to look at is, this is the area that we're concerned about. This is actually the urethra. You can see it's very tiny. It's a little tiny area. It's in front of the vagina right here. And the bladder is right above the urethra. So it's like this little balloon over here. And when it fills up with urine, there's also the ureter. The ureter is the tube that goes up to the kidney, and the kidneys are up here, okay? So here's your vagina, all right? And here's the rectum. And you could see in a female that the areas are pretty close together. So the stool is here, and we'll go over about wiping, but when you could see, if you wipe from back to front, you could be pulling some of those organisms and bad stuff forward, and then this tiny little tube is what gets in trouble, and the organisms go up that tube. So right away you can see the visual for a female, why they get urinary tract infections so easily. If it happens in the ureters and it goes up to the kidneys, it's called an upper urinary tract infection, okay? And they could be more serious. We're going to now look at the male, and we're going to compare so you could see how the difference in the anatomy is. Now, for the men, their urethra is much longer, as you see. So look at how the chances of getting urinary tract infections are much less. Here's the rectum here. Here's the urethra. If persons are wiping back to front or whatever, you could see how it's probably not going to get up into the urethra. But just to go over the anatomy here, there's the urethra. Here is the prostate gland that sits like a donut around the urethra. And just to kind of think about that, if the prostate gland lands up getting swollen, you could see how it would push on this little tiny and squeeze this little tube and cause urinary retention, it's called. So what would happen? The urine would back up into this bladder, like we saw before, and the bladder would get distended, and the person wouldn't be urinating, and then the urine would back up this tube, which is the ureter, into the kidney, and that's when people get those kidney infections. So men are at risk as well if their prostate is not doing too well. So think about that also. And also men could have urethritis. They can also have urinary tract infections for other reasons. So we'll talk more about that. Okay, so to continue to move on. So how does it occur? We kind of talked about that. The bacteria travels up the bladder. It can happen during sex, so it's really important to urinate after having intercourse. Bacteria from the rectum enters that area. So what are some of the symptoms of a urinary tract infection? Sometimes there's this foul smelling urine, a persistent urge to urinate, like I gotta go again. You just went to the bathroom and now you gotta go again. The urine could be cloudy when you look in the toilet. There may be a burning sensation at the end of urinating, and that's called cystitis, which means the bladder is not happy. And if it happens at the beginning of the urinating, it's called urethritis, and that's also calling the urethra is not happy. You can have small bits of little bits of leaking of urine happening frequently. The urine might be pink, it may be red. And there might be actually pelvic pain right above the pubic bone and below the belly button. It just feels uncomfortable. Okay, pyelonephritis is acute kidney infection, and that involves the upper, and that's the kidney area. Now, flank pain, which is your back, when the doctor might have put, or the practitioner might just kind of give a little push on your lower waist area in the back. If that makes you jump, it's because your kidneys are feeling inflamed. You may have a high fever and shaking, chills, and nausea and vomiting. So pyelonephritis is nothing to take lightly. It can lead to sepsis, bacteremia, which is the same thing as sepsis, and you can land up in the hospital on intravenous antibiotics. Okay, so to move on here, we're going to talk about the risk factors for urinary tract infections. Well, being female, as you can see, can definitely be a reason. Having that short urethra puts us more at risk. Having a new sex partner or being a sexually active person is also important. So it's really important to urinate after having sex, like we mentioned before. Women who use diaphragms or use spermicidal agents, they should mix up their use for birth control, because that could also cause urinary tract infections. Women who hit menopause, when the estrogen drops, lots of things happen to us women when we hit menopause. Our bones change and we become more susceptible to urinary tract infections. People who are born with birth defects, where the anatomy is not put in the right order, can definitely be having problems from urinary tract infections and may need surgery to correct that. Blockages in the urinary tract, like a kidney stone. If kidney stones get large enough and there's enough of them, they can block the flow of the urine. And so the urine doesn't get filtered out, it doesn't get down to the ureter, and the kidneys get infected. And we just talked about a large prostate. So I do tell people, think about it like being a donut with a straw in the middle of it, and the straw is getting squeezed by the donut. When the prostate gets either inflamed by infection, or because you have a prostate cancer perhaps, or a tumor on it, it can enlarge the prostate, squeeze that urethra, and cause backup of urine. And if you have a poor immune system, like a diabetic, you're more at risk for urinary tract infections, also because of higher sugars. People who self-catheterize, that have retention, using catheters where they're going in through that urethra over and over again with a catheter, which is a foreign object, are more at risk. And these are people who have paralysis from neurological disorders and need to catheterize in order to empty their bladder. And also people who have had any urological procedures that are surgical, they tend to have problems as well, because a catheter might be put in while another area of the urinary tract is healing. And so urinary tract infections can occur from the foreign object being the catheter. So let's just quick talk about some complications from having a urinary tract infection. If you have 2 or more, or in a 6-month period, or 4 or more a year, that's considered a complicated UTI. And every time you have a urinary tract infection, it builds that we need to know that so that we know how we're going to treat you the next time around. Because once you've had 1 or 2 or 3 that year, we need to know what antibiotic is going to work, because the antibiotics, the bug and the drug get very savvy. The bug becomes resistant and smart and mutates, and so the same antibiotic will not work. Another complication could be permanent kidney damage. You do not want to lose a kidney because you just didn't treat a urinary tract infection. You could have a low birth weight baby if you're pregnant and you have a urinary tract infection. So we do have urine checked when you're pregnant every time you go for your visit. So it's important to follow up with your obstetrician for regular visits, and if you have any symptoms of urinary tract infection. Urethral narrowing seen in men with recurrent urethritis, especially from STDs or sexually transmitted diseases. They can actually start developing problems where they get recurrent urinary tract infections. And we talked about sepsis. Sepsis is big. It can actually lead to death if not treated. We're going to talk about getting a sample of your urine. The first thing you're going to need to do is get one of these cups. And I have done some other videos for you for collecting urine for male and female. So take a look at those to get the real gist of that. But you need a sterile cup that comes in a plastic bag, and it has this little paper tab. And if it's broken, you don't want to use it. But once you open it, it is no longer sterile. So you don't want to put this lid down like this. You want to put it up like this, okay? That's the first thing. You may want to use something called a hat. This is really cool. You can get it in a pharmacy or have them order it for you. You can order it online. It's from Cavidium, which is a Dover product, or you can get it in one of your senior stores where you can get supplies and whatnot. And what you do is you sit this right on the commode, and it actually this is usually used for measuring urine output, but you can use it if it's clean and it's brand new as a collector for urine. And then it has a little spout, and you would then pour the urine right into the spout. And this I would not use over again. I'd probably throw it out if you're using it. The other thing you need to make sure you have is good wipes. And again, watch my video, because for men it's easy. You just have to wipe the tip of the penis, start urinating in the toilet, and then urinate the rest in the cup about 2 inches. For a female, you need to wipe the labia left and right, and then you have to go down the middle and try to keep the labia apart. And then again, midstream, you start urinating into the toilet, then either push the cup under and aim, or use one of these hats, which is really cool. Okay, there's these great wipes you can get out there called Preventable. They're really nice. They're also good to use for cleaning between incontinent product changes. So you may want to get some of these, and these are great for good care when you're changing, undergarments. But we'll go over more about that in a little bit. So we talked about getting the urine sample, and the important thing is that urine samples don't all mean the same thing. Now, it's interpreting the samples that's important, and we're going to go into that now. The patient is going to order a urinalysis and urine culture and sensitivity. So let me show you some ways of reading your results. Okay, so this is where you're going to be reading your results. You're getting the urine. The doctor gets the clinician gets the sample. They look for the appearance, the specific gravity. The main things that I want to notice for you is there glucose in the urine? Is there blood in the urine? Is there protein in the urine? But the most important marker for common bacterial infections is we're looking for nitrites. So if it's a positive nitrite and there's leukocyte esterase in it, that's a marker for white blood cells, and that means that the urine is infected a little bit. And even in a microscopic analysis, we'll see white blood cells and red blood cells. This does not necessarily mean that you have a urinary tract infection. It does say that E. coli, Klebsiella, and Proteus, which are 3 organisms that usually hang out in the urinary tract, they produce a nitrite from a nitrate. So you almost know which organism it may be already. And Pseudomonas, Enterococcus, and Coagulase negative streptococci do not. So it kind of helps the clinician already know what organisms may be there. On to the next slide is this one. We get a urine culture. Now this urine culture, if you look at, has a mixed flora. It says that it's E. coli at the top, and that's a typical organism that comes from the rectum in the stool. Greater than 100,000 colony count means that there is a urinary tract infection. Okay, so what we look at as a clinician is R means resistant. We won't use that drug at all. But S is sensitive, and sensitivity means that it can be used. So the first one, amoxicillin clavulanate, is augmentin. And if the person's not allergic to penicillin, that's a good one to use. There's a couple more down the road there, but many of them are IV drugs. So it gets a little tricky. And if you don't want to go to the hospital, we don't want to go there. You could see that if you know your antibiotics, all the cephalosporins are all resistant, and yet they're a cousin to penicillin. Well, ampicillin is resistant. So, and it looks like levaquin is also resistant. So it looks like if you're allergic to amoxicillin or have a problem with it, that may be an issue. Another important thing to mention is if you do land up on an antibiotic, to take a probiotic with it. This way you can help prevent other problems for the gut. All right, and let's look at another interpretation here. Here's a urine catheter specimen, and that's important to know because urine catheter specimens, it's taken right out of the catheter, not from the bag. If you need to collect a specimen from your mom's urine catheter, the home care nurse probably will do it, but you can be taught how to do it. And that is on another video that I will be showing you. But you can see from this that there's more than 100,000 colony count, which means that there is an infection. It's that the lower the number, you see the numbers next to all the antibiotics, the lower the number, the more sensitive the antibiotic is. So you can see that ampicillin is sensitive because it's less than 2. But that levaquin, it's resistant, and that tetracycline, it's resistant as well. And so the closer to 1 is the better, and as long as it's sensitive, it's the drug that you want to use. This one is one that has no growth. This is a culture that came. It didn't have over 100,000 colony count. It had less than 1,000 colony count, which means that there was no growth. But patients with asymptomatic bacteria, like let's say the urine showed bacteria, fungus, and UTI symptoms usually do not require treatment. Best thing to do is to drink a lot of fluids. So now we're going to talk about something really neat. We're going to talk about a product from Pathnostics, which is a company that has launched a product called Guidance UTI. And it actually came out in the market on August 17, 2020, just 6 months ago. And it was made available for home-based primary care and home health agency organizations, which is really great because when I worked in home care, you had to wait 3 to 5 days to get these results. And that's too long when you're trying to treat an older person who's got symptoms and you're not sure you got the right antibiotic present and you're waiting. So sometimes you're treating blindly, and that's not always fun to do because you're not always sure you're on the right track. So this particular product is a rapid molecular test for both the pathogen, which is the organism, and antibiotic sensitivity. And the right testing with the right treatment the first time is their motto. And the company claims that over 200,000 patient tests have been performed on behalf of 750 providers, including urology practices, and has been out there. It's been used in the hospitals, but it hasn't been used in the homes, and that's where we really need it because then the patient lands up going into the hospital if we don't get to treat it quick with the right antibiotic. So Guidance UTI also uses pooled antibiotic susceptibility testing, or PAST, a patented phenotype testing method which precisely determines the correct antibiotic even when multiple bacteria are present at the same time. That is like a dream come true for a clinician because we do seem to have more than one organism there. Sometimes there's 3 or 4, and if none are over 100,000, then it's a contaminated specimen, and we have to get another cleaner specimen from your mom or your husband or from you. What you're going to need to actually get this test done is you're going to need a test order requisition form. It is covered by Medicare, and most Medicare Advantage plans do cover it possibly with a copay. If you have any questions, you can call their office at customer service. And for all of you who know me, I have a facebook.com/caregiver success page. And there I will put phone numbers, sites that you can go to, and stuff that we went over together there so you can find it. But the phone number for Pathnostics to learn about the requisition is to call 800-493-4490. Okay, so I just want to make sure you have that, 800-493-4490. You are going to need an order form. And now what's happening, because of the fact that we are in the middle of this pandemic, the offices are not open. They do not come to your office, but they will eventually be coming to the office to pick up the supplies, have the requisition form, and take it with them. And there is other ways of working it. So make sure you call that number if you're interested in trying this product out. All right. The common antibiotics used for urinary tract infection is Bactrim, which is Ceftra, Monourol, Macrobid, which I don't use as much because it's on what's called the Beers list, and you can look that up, and Keflex and ceftriaxone. Quinolones are not used as first-line treatment, and that's the Levaquin, Cipro. They're not used for simple UTIs. They are not, if they're not diabetic and they're not having frequent UTIs, this is called a simple urinary tract infection you're having. Short-term treatment is really the name of the game. You don't want to be on it for 14 days if you don't need to. 3 to 5 days treatment, and maybe something for pain. Pyridium is something that I give for pain. It's a 3-day medicine, 100 milligrams, 3 times a day. It turns the urine orange, but it will help the pain that you're having, which is important to not have. And if the antibiotics don't work, you need to keep in touch with your healthcare practitioner, and you need to go to the hospital and maybe get intravenous treatment. Okay? So here are some other treatments that are out there, and I think it's really good that we go out, to talk about them, because there are remedies. I did run into a company called Uqora, that's UQORA.com. And I will again put this on my facebook.com/caregiver success page. And they have 3 products. They have one for urinary health, they have one for urinary control, and they have one to promote vaginal health. So the urinary health one is to help the immune system. It's good if you're sexually active. You drink it after you have sex or anytime you need extra support, and it flushes out the urinary tract system. It has ingredients that are holistic, like calcium, citric acid, D-mannose, magnesium, potassium citrate, vitamin B6, vitamin C, beetroot extract. Pretty cool product. Then there's the second one they have, which is called Control, and it's to help with this thing called Biofilm. Well, I have a biofilm problem. If you have a lot of stuff on your teeth and you end up scraping them a lot, and you have gut issues, you probably have biofilm problems in the vaginal and the urinary tract, and it builds up, and it's filled. This is filled with ingredients to help to eliminate biofilm. Biofilm is actually one or more types of microorganisms that can grow on surfaces, on gums, urinary tract, respiratory tract. I'm sure I got that problem, and I actually just ordered this for me because whenever I go walking with my husband, I have to find places to go to the bathroom all the time. I'm like, it's just embarrassing because I just have to urinate a lot. So let's see if this is going to help me. It has black pepper powder in it, curcumin, D-mannose, green tea extract. It has a vegan polymer to make the capsule, so it's really nice and holistic. The third product from this company is called Promote, and it's for vaginal health. It's a vaginal probiotic. It maintains good bacteria to balance the vaginal microbiome. And this ingredients in here is lactobacillus, chicory root, and some other things. It had over 6,000 reviews, 5-star reviews. So see for yourself, check it out. All right. And that's out there in the market. I will give you the website again. It's uqora.com. Another product that I used a lot for my older people, especially after they kept getting urinary tract infections, and it really worked well, was something called Hipurate or Hiprex. It's a urinary anti-infective. It's a medicine used to treat urinary tract infections, and it is an antibiotic, but it's used as a prophylactic treatment, and it's used after you've tried other antibiotics. So that one I found to be really, really cool. I had many patients on, and not a peep out of them for months, for many, many months after being on this. So it's a good thing to try out. Another really cool product is called UTI Stat. This is actually a low volume medical food. It can be bought as a drink. And when used with a hygiene program and hydration, it really works well. I use this also a lot. It's 2 tablespoons or 30 cc's twice a day. You mix it with a hot or a cold beverage and you drink it down. And the older person didn't seem to mind it. It didn't taste too bad. The National Center for Complementary Medicine reported that it really helps because it has a cranberry pro-anthocyanidine in it. It helps reduce the adhesion of certain E. coli bacteria to the urinary tract walls. And that's the name of the game, is reducing stickiness of organisms to the urinary tract. Another thing that's really good that you can get over the counter is something called Azo. It's got cranberry in it. It's for urinary tract health. It's equal to 1 serving glass of cranberry juice. And by the way, if you drink cranberry juice, make sure you get the unsweetened. You can get the Apple and Eve or something like that that's 100% from concentrate. Do not get the cocktail because sugar just adds more trouble, and bugs love sugar. So got to get the ones that are 100% juice. All right. It has vitamin C in it. It has 25,000 milligrams of cranberry fruit equivalent. Good stuff, and this is over the counter, and you could take it every day. There's something else out called D-mannose. It reduces the sticking, and we talked about that to the bladder walls. But use it with caution and diabetes. It actually makes blood sugars rise, so be careful. Make sure you read the labels on these products. Not everything is safe for everybody. And also, have a urinary tract infection. Some remedies you may want to try as a heating pad to the abdomen. You avoid irritating drinks like coffee and alcohol and soft drinks with citrus because they make increased bladder pain. You want to not take tub baths. Make sure you're wiping front to back and not back to front. A lot of older women sit on the toilet and they don't put the arm around them and wipe. You can wipe from the front, but if you just go a little bit in the front and then go in the back and pull back from the rectum, otherwise you're going to push that E. coli forward like we talked about, and it's going to cause problems. Try to avoid feminine sprays, avoid tub baths, empty the bladder after intercourse, and always empty fully. Sit there till you're done. Something called Crede is where you actually take your fingers and you press on your bladder, which is below your belly button, right above the pubic bone, and just push till all the urine comes out. All right? Make sure you wear light cotton underwear with crotchet pads that have cotton in them, and not tight clothes, and not something that has no breathable material. And drink a lot of fluids. If your mom doesn't want to drink fluids, use popsicles, ice cream, Jell-O if she's allowed to have it. Because anything that's liquid at room temperature, shakes, those are all liquids, and they will help her to flush out her urinary tract, or dad as well. Some great things to think about is, men can use these products. These are protective shields. If dad has an undergarment on that's an incontinent product, you can actually wick these out. You put them on the front near the penis, and at night you could just pull them out and replace them with a new one. This way, at least you're keeping the area clean and dry and without possible skin irritation and infection. Okay, and just if you have frequent urinary tract infections, You may want to consider vaginal estrogen. A squirt of that up to the vaginal area once a week kind of helps to increase the estrogen there if it's okay with your clinician, and it will help the normal flora to combat urinary tract infections. Sometimes a single dose of antibiotics after intercourse works really well, just one quick dose, or a low dose antibiotic for 6 months. I have had patients on some antibiotics for 6 months. But don't forget, antibiotics are the last resort, and we're not going to want to treat you with an antibiotic without a culture. It's just not good medicine. We need to know the bug to treat with the right drug. So make sure that we get a clean specimen so that we can provide great care for your parents and for yourself, and to make you have a great life without these urinary tract infections. All right? So I'm glad you joined me for this video. I know it was a little long. Hope you finished your coffee or your drink. And please subscribe to my YouTube channel if you like it. I've got lots of videos here for you. Check out my book on www.caregiversuccess.com. It's a great book full of tips and tools to help you stay well. And go to my Facebook page at caregiversuccess.com, and I'll have this information for you about urinary tract infections. So from Nancy, the nurse practitioner, glad you joined me today. Have a great time, and see you at the next video. Bye now.